Have you always assumed that you just have to live with those wrinkles and fine lines?
Not anymore, right?
That's right. Think again. Check this out. It was all done with lasers, and what a difference. Is that incredible? Sometimes we just need a little help to look and then feel younger.
And I would say that picture took off about 10 years of that woman's face, all, again, without surgery. Dr. Andrew Campbell joins us now from Campbell Facial Plastic Surgery. Welcome back to the Morning Blend.
Thanks for having me.
Yeah, thanks for being here. Okay, those before and afters we just saw of the woman's lower part of her face was without surgery?
There was no surgery. There was healing time, but there was no surgery. It was all done with a laser, and it essentially, vaporizes the surface layer of the skin, and then during the healing process, there's a tremendous amount of collagen that gets deposited into the skin, returning that elasticity. It reduces the wrinkles. I mean, it can be pretty amazing transformation that can occur with those types of treatments.
It looks like she had surgery just because I think the results are so incredible. What types of lasers do you use?
There's a lot of different types of lasers. Some of them are not going to create any injury that requires any downtime, and then other ones can create an injury that may only require a couple of days of downtime. And then something like the picture that was shown, that type of a laser is going to give that patient about 6 days of pretty significant downtime, but the longer the downtime, the more aggressive the treatment, the greater the result that you're going to get.
I was going to say, so there's a little bit of a payoff if you do have some downtime because you're going to have more dramatic results. Is that how it goes?
That's pretty much true. I mean, there's certain lasers that are coming out now that can give you very little downtime, but you're going to need several treatments to get the result that you want. I think to really get a really significant wrinkle reduction, you're going to need some downtime. There's obviously other issues with skin. You can have pigmentation issues, you can have vascular areas or blood vessels that are visible in the skin. Obviously just texture abnormalities that aren't really wrinkles, but just kind of irregularities. And all those can typically be treated without any downtime.
As we take a look at the next picture on our screen here, I think it's interesting, again, to see very dramatic results. Was this an age spots that you were trying to treat with laser?
This is a relatively young lady who I treated several years ago. That was treatment with a chemical peel, which there's a lot of different chemicals and different depths that you can go to, but it was a medium depth chemical peel. It had several days of some downtime, but she had what a lot of people do. She abused her skin in the sun for many, many, many years, sun tanning, and it caught up with her, and she had a lot of pigmentation problems, a lot of textural issues, and it really just brightens up the skin. It gives you that youthful glow back. It got rid of the far majority of the abnormal pigmentation in her skin, and it's relatively quick. Today, we can do that with no downtime. This was many years ago that I actually did that chemical peel, and now we have intense pulse light, we have fraxilated laser therapies, things that we can do that really don't have any downtime at all, and yet can still give us these pretty amazing results.
What do you use for spider veins or varicose veins? Can you use lasers for that
We can use lasers for that. I don't typically treat varicose veins because I think there's better treatment options than we can give patients. But for smaller veins, we can use a YAG laser, which basically gets absorbed by the blood vessel, and the blood vessel gets heated up, and then it basically gets injured and it disappears. So we can use those. They work fantastic on the face. We can use them on the legs. We've treated patients' ankles and legs with that YAG laser, and it does a really nice job.
We've talked about recovery and results. I think people always want to know about swelling and redness, and you did kind of touch on that when we were looking at the first picture where there was such dramatic wrinkle reduction.
Yeah, I mean, again, it really depends on what treatment options we use. We can use things like Botox and fillers for wrinkles, which really don't have any downtime at all. You can use skincare products, which will take a very long time, but if they're medical grade skincare, you're going to get a really nice improvement in your skin quality. You can go to intense pulse light that actually darkens the pigment initially, but then over a couple of weeks it disappears, so there's really no downtime because you can wear makeup. Then you get into some of the erbium lasers, which are going to give you some downtime, but give you just a more intense result in a shorter period of time.
Speaking of
so
results,
it's very customized.
Let's look at some more pictures of the before and afters,
Sure.
because some of these are really amazing. What about this one?
Sure, this is a little bit of a combination. It was a deep erbium laser resurfacing, which is going to take care of a lot of the wrinkles. She also had some facial plastic surgery, and then she had some Restylane or hyaluronic acid filler placed in her lips and into the filtral ridges, so you can see those are slightly more prominent and gives you a little more youthful look.
Yeah, that picture on the bottom, I would have said she was 20, 30, maybe. Incredible. And men, I know, are using those options more and more often
Yeah,
now.
these are telangiectasias on a patient's face. Those are blood vessels that are visible directly right underneath the skin. And we don't have to do anything ablative to those. We can treat those with intense pulse light, which I believe this gentleman had. We can also treat them with a YAG laser. And
what
we
do you
can
mean
essentially
ablative?
Ablative means to destroy the skin, so there's no healing time. You know,
Okay.
these are treatments that you come in, you have it done, you walk out, you look fine. They may be a little gray, the vessel will be a little gray, and we know that we've now damaged it. And then over a few weeks, it literally just disappears.
How long do these results last?
Well, treatments like this are typically going to be permanent because we are changing the skin. The question is, what happens to the skin after that? Are you taking good care of it? Do you have some sort of a process like rosacea where vessels are going to come back?
And I think these pictures are interesting because this is kind of a play-by-play of what the process was like to finally get to the end result.
Yeah, this is a micro laser peel where it's an ablative treatment, but the second picture is essentially directly after the peel. And then the third picture is, I believe, 3 days after the peel, and she's pretty much completely healed. And then the last picture is about a month out. So there's very little downtime with that, and you can get a really nice improvement in the overall quality of your skin.
And you mentioned maintenance. Skincare is important, isn't it?
It's huge. I mean, everybody that walks into my office and sees me, whether it's for a facelift or it's Botox, we talk to them about skincare. I mean, it's the one thing that everybody can do that's going to, one, maintain what they have and most likely actually improve it. And obviously people are seeing me, they're spending a lot of money to try to look better. And once we get them there, we want to keep them there for a very long period of time. So skin care maintenance and sun protection are the two huge things that we really preach in the office.
But to help them with some of the cost, if you want to come in and find out what's right for you, you're here with a special offer today for Morning Blend viewers.
Yeah, for anybody that calls from basically now to the end of September, we're going to give them half off their first treatment, pretty much whatever it is.
And they can come in for our consultation too, because
Sure.
that's free. So if you don't know exactly what's the best option for you, they can sit down with you and you can lay out some different options with different cost ranges.
Right,
too.
that's certainly what's nice about my office is that we have such a broad range of things that we can provide patients. They really have a lot of choice. And that's what's neat about customizing treatments is we can really choose what's best for that patient. We don't have to give them something that isn't the best because we pretty much have everything we can give them.
It's wonderful. Thank you so much for being here today. We
Thanks.
appreciate your time. And again, you can get in touch with Dr. Campbell at his office, and it's 50% off, so a good time to mention the Morning Blend before the end of the month. Thanks again.